To continue Chapter 1, we didn't finish this in lecture. The dental hygienist, of course, this is you. You'll be a college graduate. You've got a demonstrated skill set and a knowledge base, and you're also professional. You will have passed your National Board Examination, which is a knowledge-based examination, and then you will also have passed your State Regional Skills Examination, which is a practical examination. Once you've completed your educational requirement and passed both of your exams, you will apply for licensure. The state then grants you a license based on their belief that you are competent to perform all the functions necessary in the state of New York. Licensure is basically a certificate that states that you are competent to practice, and the State Board of Dentistry provides this license for you, and also you have to follow all the functions listed in the Practice Act and the regulations. To be considered a professional, you must have a specialized field of study, and in that specialized field of study, you understand the value of your study to society. You know that it's intensive and it's academic as well as clinical, and you have set standards of practice, and these are basic standards. It's regulated by the group, which is the dental profession or the dental society. We don't have our own State Board of Dentistry as hygienists, and it's an external recognition by society. Society says, oh, you're a hygienist. You're not just an individual or another person, a lay person. You're an actual hygienist, just like a dentist falls into that category of recognition, and many other professions. You have a code of ethics that you have to follow from your organization, and again, it is an organized association. There are three different models of professionalism, and again, this is sort of a philosophical portion of the course where we talk about different theories or models, philosophical models. And three of the main models that the textbook talks about are the commercial model, the guild, and the interactive model. In the commercial model, we see all dentists are in competition. They're all selling the same commodity, which is dental services, to the public for the best price possible. And therefore, by having the best price, we have competition, and competition creates a true marketplace, which means you can shop for dentistry. No obligation exists between the dentist and the patient. There are other dentists or even the community. The guild model is basically an older theory, which states that you have a certain group, and those members within that group control the knowledge, the skill, and the competency of that group. The patient has needs. The dentist is a member of that professional group. They provide care to a very passive, uninformed patient. Someone that really doesn't ask questions. They just sit in the chair and they expect the dentist to take care of them, sort of like a parent would. And that's why they call it a paternalistic relationship. Now, the interactive model is the model that we want to live by. It's the patient and the dentist are equal. And by what I mean, when I say dentist, I mean dental professionals, even though they state that it's the dentist in most of these models, but it really is all the professionals that are licensed that provide services to the public. So they're equal. You are equal with the dentist is equal with the patient, and you are equal with the patient as well. You have certain roles of equal moral status in the process of care, which means the patient needs to live up to what their requirements are as a patient or client, and you as a hygienist or a dentist or a dental assistant need to live up to those same moral standards. So you both have to have moral standards. The patient determines their own needs based on personal values and priorities. So their personal values and their priorities determine what they need to have done. So they're distinctive roles. You do what you do, the patient does what they do, or what they should be required to do is brush their teeth and come for office visits and have their work done. And then you all work together to attain a main goal and which is to maintain oral health. Competency, we talked so much about this last semester. You've read about it. You know we have that Dental Studies Program's Policies Manual that has all the competencies for dental hygiene in it. It's based on IDEA, and those competencies, basically for a definition, are those basic essential skills that require knowledge and skill and ability to perform. That makes you competent. Now, do you think you're competent right at this point in time? No, you're not, because you still have another semester to go. You will be competent when you graduate from our program. Some of the courses that you have taken already, you are competent in, but as far as the dental hygiene portion of it, the clinical portion of it, you are still not competent until you've finished your actual last course that you're in right now. And so by being competent, it means you can perform those basic skills using the basic amount of knowledge that you have obtained in this program. Dental hygiene competencies are really the ones you're using within the practice setting to meet those needs of the patient. Now, the person or people who determine competency and give us guidelines as a program are the Commission on Dental Accreditation, CODA. They publish these standards. They're endorsed by dentists, hygienists, and dental educators as valid and appropriate standards. And then all of the dental hygiene, dental programs, whoever has these published standards in their programs, they all are consistent throughout the entire country. And these are, again, our minimum standards. That's why we have many more standards for our particular program. But those are the basic minimum standards for each program. Accreditation, again, we know that it's 7 years. We won't have another accreditation, so it's a 7-year period of time. And it's really used just like a license to protect the welfare of the public, or even to protect the student who is an individual, public individual, until they become a dental hygienist. And we call it regional and specialized accrediting agencies. So regional meaning Northeast, Midwest, and then Western, or even Southern. These agencies, they visit certain jurisdictions, and they, like our accrediting agency, they came to our school, but they'll also go to many other schools in the Northeast. And they are the Commission on Dental Accreditation, and they're recognized by the U.S. Department of Education. There are 30 members on CODA. 1 member of the American Dental Hygienists Association sits on the board, and we utilize peer review, which means the other members of the board were all from other colleges, whether they're four-year colleges or community colleges. They're all from other colleges, and they are all professors in those colleges. And so they do that formal on-site review for us, and that's who came and visited us. It was CODA's board, and again, it all depends on the number. We had 1 dentist, we had 1 member of the American Dental Hygiene Association, and we had 2 members, 1 dental assistant and 1 dental hygienist, and they were all from formal education programs in the United States. We have patient care competencies as well. The graduate, meaning you, will be competent in providing dental hygiene care for the child, the adolescent, the adult, and the medically compromised patient. Wonder where we got that from. CODA. And the graduate must be competent in evaluation of scientific literature. These are just 2 of the patient care competencies that are required of us in our program, and you. Now there's 5 stages of competency. there's novice, there's advanced beginner, and then there's a competent, and then there's proficiency and expertise. So if you were to look at who is a novice, novice would be you or the freshman last semester, even this semester, freshman, and the advanced beginner would be you probably last semester and even this semester, and hopefully by the time you finish and are ready to graduate, you will become competent. Now, you will be competent for any number of years, depending on how long you work during the time you've graduated and how many hours you've put in and how many patients you've seen. So if you're only working a substitute job, maybe a couple days a month, you won't reach proficiency as soon as someone who is working 30 hours a week. Or you might not even reach proficiency in scaling if you work for an orthodontist versus a general dentist or a periodontist. You will become an expert after years of experience. And again, people become experts or have expertise at different stages. It all depends on how much work you have put into the position and how long you've been working. So you would say that I'm an expert, and our clinical assistants that have graduated maybe within the last 5 years are proficient, and you will be competent by the time you graduate. Advanced beginner would be sophomore year, novice would be freshman year. And some of our clinical assistants are at the expertise level. And our adjuncts are definitely at the expertise level. Different traits for the dental hygienist. Some of them are basically nurtured in the dental hygiene student, you, and this carries out into clinical practice. For example, we teach you infection control. We teach you everything you are supposed to do for infection control. When you graduate and you're out in practice, you know what you should be doing, but you may not be doing what you should be doing. So we've nurtured you, we've taught you, you've basically understood why you need to practice with PPEs and what have you, yet we can't make you follow that once you get out into practice. Yet we have set those traits or developed those traits. Now, traits a dental hygiene student must strive to develop also are in honesty and integrity, caring and compassion, reliability and responsibility, maturity and self-analysis, loyalty, interpersonal communication, tolerance for others, and respect for others. You also have legal requirements. When you uphold a license, you must uphold the statutes and the laws in the Practice Act. No ifs, ands, or buts about it. If you do not, for example, if you drive drunk or under the influence, you are threatening your license. There's no ignorance allowed for noncompliance. When you graduate, you will know what's required of you by state law, and if you choose not to follow the law, then you cannot claim ignorance. Each state or territory is responsible legislatively to protect the public. That's why each state has different guidelines set forth in their practice acts. Licensure is designed to enforce practice codes, establish standards, and sanction incompetent practitioners, or reprimand incompetent practitioners. Now, the Practice Act is also designed to protect the public. That's a board question. Legislative changes occur. When do they occur? When there's a need and a demand for dental care. That's why we're looking at the advanced dental hygiene practitioner, because there's a need for dental hygiene practitioners in underserved areas. that's when there'll be a legislative change. When the distribution of dental health care providers is unequal, less in underdeveloped areas versus developed areas. If there's federal health legislation, if there are goals of organized dental and dental hygiene associations that advocate